Maybe we'll take a lot. We did get screened and then her goes like anaphylaxis for the fever. Apparently, she's allergic to like the hormones. It sounds like the bear gets documented and they can find a Western study.
Yeah, what's up?
What's an underling?
What's a what?
An underling. I'm gonna dry it.
Oh,
That's why your dryer's messing up. Girl don't know about underling. Gotta clean that out. Once it's done. How's your dryer not caught on fire? I don't know. Yeah. They do the manual. Or you call me, find your manual.
Wait, oh God, I should have tried to learn from like I did. Hold on, go to the
We do. That's because my dad's kind of a hoarder.
I've been to like 4 generations.
Mind you, I'm only, that dryer's older than me.
Oh, yeah.
But,
Car used to be one.
but I also, my dad's a heavy equipment mechanic.
Oh, yeah, so you can work on all of the tricks of your easy.
I was taught how to work everything too. So like I was not allowed to have my car until I learned how to shut off tire,
Yeah.
change the filter. He attached my
all right, guys, get signed into the Kahoot. We're gonna get started with our chapter.
no, my
Okay.
Oh, yeah.
And then we'll get our chapter 24 later. The lecture is going to cover diseases of the gastrointestinal system as well as our Helminth diseases. That should be pretty good stuff. So for the lab exam, might remind you at the end of the lecture, if I remember to remind you, when we go into the lab, so previously at the lab midterm one, you know, you guys were able to like kind of get settled and whatever like that. But when we go into the lab this time, because every single station has tubes or microscopes set up at them, there's only one station that doesn't have something at it. Okay, so being aware of that. All right, is anybody taking the test in the testing center? So, okay, good, because I needed a spot. So that's what I was saying, because I have a student from one of my other classes that needed to take it with us today. That opened up a spot. That's the only reason I was asking. That's fine. So I just wanted to be aware of that before one of my other students has appointment, doctor's appointment, and so they want to take it with you guys. Anyways, so when we go into the lab, you guys need to be ready to log in to a lockdown browser, like immediately. Don't have your notes up. Don't be looking at notes before that. Have your computers ready. I would, in fact, recommend that you have those pages pulled up before we go up there. Like pull them up in here and then just bring your computers up there. Or if that's the case, then you can set it up when you're there. I want minimal amount of people like browsing on their computers when you get in there, because you're going to be coming to a site and you're going to be able to see all around you, all the tubes. People just be like, oh yeah, this one. Oh yeah, that one. No, your time to prepare for the exam was up until the exam starts. And once you enter that room, I'm going to count that as time for when the exam starts. So the only things that you should be pulling up when we get into the lab, be prepared for that. Okay, be prepared for that. The only thing you should be pulling up is getting ready to take the exam, because I don't have the patience for much of this point. So the reason I'm saying that is I cannot tell you how many emails I got last night asking me what's going to be on the test. Are you kidding me at this point? Okay, so it was nobody in this class did that. May or may not have been people from my hybrid class. Okay, but having said that, like I am just like, no, like you were welcome to have asked me that question a couple weeks ago, but at this point, the night before the exam is coming and their test is today.
You ain't got it now.
You ain't got it now. You ain't gonna get it. Exactly. Okay, so be aware of that. Right. So we'll get that going. So today, that's it for my little spiel for today. So we're gonna get going with our Kahoot stuff. I'm gonna give you just a minute to make sure everybody is signed in, and then we're gonna get going through Kahoot and the lecture. Literally getting emails until 2 a.m. last night about stuff like that. I'm just like,
obviously I'm not ready.
what are you doing? Like,
I studied the lab stuff literally once before going to bed, and I was like, I know this.
Yeah.
It's on my, it's just looking and seeing like, oh, this means.
No,
Lab
and
is so much easier, like, I understand lab so much
You
more.
really do.
some
Yeah,
people
like,
do,
I'm sure
some
I'm
people
so
do.
lost in here, but lab I understand.
Some people do. It's a matter of just knowing the colors and what the colors mean.
Yeah, not for-
All right. All right, let's get going with our Kahoot, folks.
Yeah, I know, I realize.
Make
that.
sure you're logged in, make sure you're logged in, and we're gonna get going. Question number 1, reviewing chapter 22, which was our respiratory diseases. All right, which of the following are some of the primary defenses for the respiratory system? The primary ones. It's going to be first line of defense. So it is all of the above. The microbial biota for the respiratory system is pretty strong, and it provides microbial antagonism. Those guys take up the stadium seeds and also produce antimicrobial peptides and stuff like that that prevent pathogens from taking hold. They also use up the nutrients in the area so the pathogens can't use them. So that's how microbial antagonism will work from our microbial biota in our respiratory system. Next, what pathogen is the primary cause of bacterial pharyngitis? Which of these choices did we talk about with pharyngitis? All righty. So a lot of you guys did pick up on the strep part of that. That is correct. But for pharyngitis, the primary cause of pharyngitis, which is sore throat, it's inflamed throat tissue. Yeah.
Pneumonia is gonna usually be a pneumonia.
Sure, so true pneumonia, but it's also for meningitis. Yes, so the primary cause of bacterial meningitis is Streptococcus pneumoniae. So, but for the sore throat, the pharyngitis, the inflammation in the throat, that is going to be Streptococcus pyogenes.
Because your throat feels like it's on fire.
Yes, pyogen, you think of that, that helps. Okay, so what type of microbe is the cause of pertussis? And these kinds of questions, I've warned you before, are going to be pretty common in the more, straightforward questions associated with Unit 4. All right, we got quite the spread here. Pertussis is caused by the bacteria Bordetella pertussis. It is a bacterium. Wow, what is happening there? Next question. Pertussis has been eradicated from the United States. True or false?
When he's on it.
It's not uncommon. I'm just saying that. I'm going. There is a vaccine for this. Part of your Tdap vaccine, the tetanus, diphtheria, and pertussis vaccine, DTP or Tdap, there's just different versions of it, but they're the same thing essentially. So pertussis we do have a vaccine for, but it's definitely not eradicated. That little baby that we saw the video of was not that long ago. All right. What phase of pertussis involves the uncontrollable cough? There are 3 phases in pertussis. Which one has the uncontrollable cough? There's 4 listed up here, so one of these is not one of the phases of pertussis. All righty, the 3 phases of pertussis are the catarrhal phase, which is like our prodrome phase. It's basically whenever you have just respiratory symptoms in general. Once you get that serious uncontrollable cough, that is the paroxysmal phase. And then once you clear the bacteria, but you have your damaged cilia left behind that leaves you susceptible to secondary infections, that's the convalescent phase. Know those terms. Next question. What 2 surface molecules do the H and N stand for in flu designations? All right, so this is going to be hemagglutinin and neuraminidase. Next question. What's the term when flu virus genome segments from two strains reassort the gene segments in another animal host and make a new strain? Well, two of these are the exact same thing. Whoops. Oops. It's antigenic shift. Antigenic drift is when we just get random little mutation. When we have the gene reassortment, that is antigenic shift. All right.
Like Katy Perry's drifting through the wind. It's like-
Sure, if you want to do that, don't let me stop you. So what is the most common cause of community-acquired pneumonia? We did talk about this just a second ago. Most common cause of community-acquired pneumonia. We talked about community-acquired pneumonias and we talked about hospital-acquired pneumonias. Community-acquired. So walking pneumonia fell into one of the community-acquired, but the most common community-acquired pneumonia is going to be caused by Streptococcus pneumoniae. If you have walking pneumonia, that's another type of community-acquired, but it's not the most common cause of pneumonia. The walking pneumonia is Mycoplasma species. This Mycoplasma pneumoniae is the walking pneumonia. True pneumonia, that's going to make it really hard to breathe and might have you leaving you cyanotic and looking pale and stuff. That's going to be caused by Streptococcus pneumoniae mostly. All right, excellent. Next question. True or false? The common cold is easily and successfully treated with any variety of antibiotics. I'm hoping that these quick answers are the good ones. I'm hoping. All right, so this is false. Common cold is primarily caused by viruses, and we never treat viruses with antibiotics, ever. So we also don't usually treat the common cold. We just let people get over it. Common cold, again, there's 200 different viruses that are associated with common cold. These will include rhinoviruses, coronaviruses, adenoviruses, and RSV. And so they're all can be related back to causing common cold symptoms. Yes.
If you treat a common cold with an antibacterial, that can cause C. diff, right?
It potentially could, right? So we're thinking on that higher level now. If you take an antibiotic that is systemic, that it could kill off your biome in your gut and could cause C. diff to overgrow, and you could have C. diff as a result of that. It's less common with treating like upper respiratory infections with antibiotics, just because those antibiotics are typically chosen because they are not going to be as having a big impact on your gut biome. But potentially you could if you had strong enough antibiotic involved with that.
That's how my mom's.
It's possible. Your patient has a positive PPD tuberculin skin test, also known as the Manitou skin test, as well as a concerning follow-up chest x-ray. How would you confirm what you think their diagnosis might be? All right, so this is going to be the acid-fast stain of the sputum sample, the PPD skin test or the Manitou skin test. It tests for having an immune reaction to tuberculosis. So the protein of tuberculosis is called tuberculin. And so if you have a suggested sensitivity to tuberculin protein, you are suspected of having tuberculosis. We often do a chest x-ray, and when that suggests that we have some stuff hanging out in the lungs that shouldn't be there, then we would potentially get a sample of the sputum and do an acid-fast stain on it. If that person has Mycobacterium tuberculosis, the cause of tuberculosis, if they have that, what color will their cells be in the acid-fast stain? What color will those pathogen cells be in the acid-fast stain? Fuchsia, that reddish pink color, right? Yeah, excellent. I better know that. Y'all know that's going to be on the lab exam, right? Okay. Bringing it full circle. Here's our podium, and then we're going to get into chapter 23, which is our GI stuff and our Helminths. Excellent work, folks. All right. Chapter 23. So chapter 23, we're in our GI system stuff. First to review the GI system. We've got the mouth, we've got the esophagus. The pharynx is also involved in your GI system because that's how stuff's getting into the GI system. Then we have our stomach and then our accessory organs like our liver, our gallbladder, our pancreas, our salivary glands that are kind of feeding enzymes into the process involved in digestion, which is the whole purpose of our gastrointestinal tract. We have our small intestine leading into our large intestine. I'm not necessarily going into the parts of those sections. And then we have the waste leading out through the rectum and the anus. This is in the GI tract overall, just in general, we have a very high number of microbes here, creating microbial antagonism, as well as helping in digesting our food as it's passing through our GI system. It's part of the mucosa. Anytime you have basically a surface of your body that is wet, that's a mucosa. And so this includes your mouth and your throat and your entire lining of your GI tract, including your lungs. All of that is going to be mucosa. And so anytime you have mucosa, we have secretory IgA, antibody that's going to be secreted in that mucosa that wouldn't necessarily protect it within the bloodstream, but in the mucous membranes themselves. In the saliva, we have lysozyme, which breaks down peptidoglycan, and lactoferrin, which is a molecule that basically hoards away iron so the microbes can't use it. They need iron too, just like we do. Bile itself is also antimicrobial. It is slightly alkaline, and so that can also be something that creates this really strange pH shift in the stomach being highly acidic and the bile being alkaline, causing issues with some microbes being able to survive that. And then we have the GALT, which is our gut-associated lymphoid tissue. All of this lymphatic tissue in the gut area, keeping all of our white blood cells and stuff at the ready for fighting off any potential invaders. Our oral biome is definitely dominated by bacterial species, though we do have some methane-producing archaea that can be found in the mouth, as well as fungi and some protozoa. We don't know much about the virome, which is viruses that are part of our biome yet, but that is being highly studied. We're not sure what the roles of them would be, but hey, we've got pretty much everything in your biome in the GI tract except for helminths. Helminths are not a natural part of your GI tract. Okay, they're not part of your biome, but pretty much everything else can be. In the large intestine, for every gram of contents that are in your large intestine right now, there are 10 to the 11th microbes. There are more microbes in 1 centimeter of your gut than there have ever been people on the planet. I don't even mean right now. I mean that have ever existed on the entire history of the planet. There are more microbes in a centimeter of your gut than there have ever been people on the planet in all of history. And that's pretty impressive. So lots of microbes. All right, for the appendix, I want to say something about the appendix. We think the appendix might serve as basically a reservoir of your biome, so that if your biome gets disrupted, your body could potentially replenish that from your appendix. So we think that that is probably the role that the appendix is playing in your gut biome. So our gut biota has a protective function with microbial antagonism. It also teaches our immune system on what it should or shouldn't respond to and how, especially within the gut. Because keep in mind, most of your gut bacteria are gram negative. And so what molecule do gram negatives have on their surface that can trigger the immune response? Gram negatives, what molecules do they have on their surface that can trigger your immune response? Endotoxin, we're getting there, endotoxin, LPS. Lipopolysaccharide, also known as endotoxin. This is a highly stimulating molecule that can trigger the inflammatory response and the aftermath of all of your immune response. And so gram negatives have this on their surface, regardless of where they are in your body. But your gut has been trained not to have that reaction to those microbes in your gut. So we hopefully don't have a constant inflammatory response in your gut. So we've had to teach our immune system how to behave there, but still maintain the immunity to that throughout the rest of our body. So this is a very complex level of training that is going on. And that's why we have such a high amount of lymphatic tissue in the gut as well. The microbes that are in your gut also help to digest food. There's plenty of nutrients that you would not be able to digest without the help of your microbiome. And in fact, this is such an issue that in babies, if they're not getting a microbiome from breastfeeding or from probiotics in formula, that they will develop colic because they're not able to digest some of the sugars that are in milk. And so we need our microbes to help us break down some of our food and nutrients. We would consider this to be what we would call a symbiosis, a mutualism. Right? We're benefiting and they're benefiting too. We're giving them nutrients and food and a safe environment. And they're providing us with immune training, as well as breaking down our foods and providing protection from pathogens. So we're going to get into our disease stuff now. And I'm not going to make you guys raise your hands, but I'm going to have you think about, when's the last time you flossed? So some of us, maybe this morning, some of us are probably sitting there like, oh, Jesus, you're my dentist now. Thanks. Like, but you should be flossing every day, ideally,
A couple times.
preferably. But most dentists that I've visited will accept every other day, once every other day. But if you're doing less than that, you're not flossing enough. And we're talking really working in between your teeth, as well as in the tops, up in the gum, not just like a little bit of a swivel in there, right? Getting up into the gum tissue and stuff. And this is why dental caries. So dental caries is another word for tooth decay. And you might think, oh, I don't have cavities. I'm not necessarily talking about tooth decay that would lead to needing a filling or needing a root canal or something. I'm talking about any tooth decay. If there are bacteria growing in your mouth right now, and there are, whether you brush or floss or not, but if you don't, you have more of an issue with this. These bacteria ferment any sugars that come into your mouth and then create biofilms that we refer to as plaque or tartar buildup. And then those guys ferment those sugars and create acid. Just like in our organisms, when they ferment, they create acid. They turned our media yellow when they did that, right? So these same bacteria can be in your mouth, on your teeth right now, fermenting any sugars that were left behind from you not brushing or flossing well, or from whatever you ate today or drank today, and fermenting and creating acid that eats away at your tooth enamel. And if that is happening, that is dental caries. You need to have necessarily a cavity, but whenever that goes to a point that we have enough breakdown of the enamel and the dentin underneath, then we're developing cavities. And cavities can lead to damage of the pulp and potentially even the root, and that might lead to things like root canal or losing your teeth, etc. So all of this is in the realm of dental caries, which is tooth decay. Anybody feeling like their mouth is gross right now? I brush and floss every day. I brush my teeth twice a day. It's actually not recommended that you brush your teeth after you eat. Do you know why that might be? Because your own biome in your mouth also needs to be maintained in order to provide that microbial antagonism. And so if you're brushing right after you eat, then all of the enzymes that are normally going to be in place to help your biome and to help break down the food and things like that also can cause softening of your teeth. So brushing after your teeth and having all that sudsing and chemicals that are in toothpaste that help kill off and remove bacteria and plaque are going to also be affecting your biome, as well as softening your enamel and making it more likely that you're going to have dental caries. Yes.
That was kind of a dumb question, but we've talked about how my mother is with medicine. Is fluoride actually like gonna kill you?
Why would you think that? We've been using fluoride in our toothpaste and our water for decades. People dying from that? When they've been dying from that? They're dying from heart disease and cancer. Worry about that. Tell your mom that. Worry about heart disease and cancer.
I bought a toothpaste and she was like, that has fluoride in it, you can't use it. I was like, that's so cool. I'm 18.
Y'all will go back in time and look at the wooden teeth and things that people had back then, and then come and tell me that fluoride isn't helping people keep their teeth. Right, yes. When we started using fluoride, people didn't need dentures as much. They didn't need as much tooth replacement. They didn't lose as many teeth. And so fluoride has helped dramatically in reducing tooth decay, dramatically. Just having it in our water has helped because y'all ain't flossing and brushing as much as you're supposed to be. Nobody is. And so this is helping you out. Look and see what happens when we take the fluoride out of your water. What happens to your teeth? I'm not going to pay for your dental work. Yeah.
So like they make kids like training toothpaste. They make it like fluoride free, safe to swallow.
Yes, because they're probably going to eat it or swallow too much of it. And so most of us as adults, we know you brush your teeth and you spit it out. You don't want to ingest too much of it, but you can handle the small amounts that if you're brushing your teeth and rinsing afterwards and not swallowing your toothpaste, that'd be fine. But the risk with kids is that, oh, it's something that tastes sugary and sweet. And so they'll just chug down the whole tube of it. That much fluoride can cause other problems with your microbiome and things like that. But it's not something that's going to create mind control or lead to you just flat out dying. Fluoride is a molecule that's like present in other things in our environment as well. So even just taking it out of your toothpaste and your water, you're still going to have fluoride in your life.
So if you drink too much fluoride, will it calcify your pituitary gland, or is that?
I don't know anything about that. Hate to break it to you, y'all. Your pituitary gland's going to calcify.
Yeah.
Period. That's part of getting older. It's not because of fluoride that happens, it's because you're getting older that happens. We can have discussions about, that's more of a physiology and an anatomy kind of a question, but your pituitary gland, whether it calcifies sooner or later, yeah, I mean, I don't know what to tell you, but it's going to calcify at some point. Are you speeding that up with certain things, or are you slowing it down by not doing certain things? I don't know enough about that stuff. It's not really a question for me, but I'm going to tell you that it's going to calcify. It's part of the natural process of aging. How much it's going to affect your body when it does calcify, like I said, it's part of the natural process of aging. And I'm not sure that you're really missing out if your pituitary gland calcifies or not. If you're one of those people that believes your pituitary gland is like your third eye, I don't know where you're getting that from, and I'd love to hear your evidence. Okay? I'd love to hear it. I'd love to, because that's another thing, right? A lot of people are saying like, oh, our ability to be intuitive and like understanding of what might happen to us in our lives, we've lost that because our pituitary glands are what made you think that that's what your pituitary gland does? I don't know. Right. Let's stay away from social media. I feel like we're not meant to have as much influence on us from areas that are not actually educated in their statements. Don't believe everything you see, right? And I really mean that. Yes.
I was just gonna say for dental caries, like, does everyone have this?
Yes. So even people who like brush and floss, you're still going to have bacteria there that can still be fermenting, but you're keeping it at a certain level of control. You're never going to be able to eliminate the likelihood of these bacteria just because your mouth has its own biome. And most of this is going to be overgrowth of the guys that are already part of your biome. And just providing them sugars, and the sugars are going to hide out in the spaces in between your teeth where your toothbrush doesn't reach. And so this is the issue with dental caries. So this is by far, dental caries is the most common infectious disease of human beings. Is it contagious? In a way. So you can get biome from like your kissing partners and things like that, that can then alter your own biome. And some of these microbes, if you have them as part of your biome, will make you more susceptible to serious tooth decay diseases like gingivitis and periodontitis. Okay. So Streptococcus mutans and Streptococcus sobrinus are the main causes of our fermentation and acid production that leads to tooth decay. Plaque development and karyogenesis. Karyogenesis is the progression of tooth decay. So basically what happens is the bacteria will attach to imperfections in your teeth or divots just in your molars or whatever it is. They'll attach there and they'll grow and create a biofilm. And then more and more bacteria can join in on that biofilm, like we've learned all about biofilms. Plaque is a biofilm. And what we have forming there is a biofilm. So we look at pictures like this person on the back of their tooth, we've scraped away some of that biofilm that has formed, likely from bacteria like Streptococcus sobrinus and Streptococcus mutans. But if we look at this under the microscope, we will see there's a lot of different kinds of bacteria and other species that can be involved in that biofilm. Periodontitis initially starts out as gingivitis. So gingivitis is when you have inflammation of the gingiva or the gums. Periodontitis is whenever that inflammation leads to increased spread of the inflammation within the gum tissues, the bone, and around the roots of the teeth. What we have with periodontitis is swelling, loss of normal contour, patches of redness, and increased bleeding of the gums. If your gums are redder near your teeth or in those little spaces in between your teeth, you have gingivitis. If you floss and it bleeds, you have gingivitis. That is gingivitis. And if you're one of those people who's like, well, I floss and it hurts, you have gingivitis. That's why. Floss more. Floss more. Promise it'll go away. Give it a week or two of daily flossing and it will get better because you'll remove the plaque and you'll remove the bacteria and you'll be brushing it all away. I highly recommend, as your dentists will as well, floss, then brush, then mouthwash. Use a mouthwash that has hydrogen peroxide in it. It will work better for removing the guys that are anaerobic, and it will help with whitening of your teeth. And if you're like me, I grind my teeth like it is my freaking job. I really grind my teeth. When I go to the dentist, my dentist is like, oh my God, like your teeth, you grind your teeth, don't you? Like, do you know that you grind your teeth? I was like, my guy, I grind my teeth when I'm awake and when I'm asleep. It's just something I don't even consciously do. And I'm like always kind of doing it. And so I have like mouth guards that I wear at night to help prevent with that. But like in the day, I talk so much, I can't really keep mouth guards in to keep me from grinding my teeth in the day. But that creates these surfaces that makes it more likely for that bacteria to be able to get into my teeth. I have only had one cavity in my entire life on my absolute backmost top molar. And you better believe that ever since I got that one cavity, I brush the living shit out of the back of my teeth and floss back there and everything, because most people don't brush or floss very well on their back teeth. You want to get behind that tooth and really work that floss in there. I've had one cavity where I've had to have one filling. I've had 3 root canals, all related to damaging my teeth from trauma. So my front teeth are fake. I have veneers on like all my front teeth because I've knocked them out from falling off my bicycle. I'll tell you, I hate a dentist, and the thing to keep you out of the dentist is brushing, flossing, and mouthwash. Do it. Yes. Did you have something you were going to say?
I was literally just gonna say you have very nice teeth.
Yes. They are fake. They cost me a lot of money. So, when I was a kid, right, when I was a kid, I had to have braces. I had like gaps in my teeth and whatever. I had braces, whatever a lot of us have. But ever since then, I'm like, man, I hate a dentist. And I've knocked my teeth. I fell off a bike once, and then I knocked out my teeth from laser tag once because I was running when you're not supposed to. All sorts of stuff. I've knocked out my teeth like 3 different times. And so I have fake teeth in the front from that. But I'm telling you, if you haven't had a root canal, you do not want one. I am telling you, you don't. It is the most traumatizing experience you will ever have. I had like my front teeth, when I knocked them out, they didn't do a root canal. Years later, the root just died from that trauma later on. And it wasn't from tooth decay or anything. I had caps on my teeth and whatever, and I flossed and I brushed and whatever. But the roots just died. And then like the natural biome in my body led to that becoming an infection that became an abscess up in the top part of my maxilla, right? Those of you who have had anatomy, maxilla. And so they had to cut away my gum tissue in the top and drill into the bone and remove out all the infected tissue. That's called an apicoectomy. And you do not get anesthesia for that. We're talking 2 hours of drilling into my skull. There is no level of your, earbuds drowning out that sound. I'm telling you.
Yeah, they tried. They really tried.
Yes. I had my headphones up all the way. I had like 8 shots of Novocaine. They had to give more shots as they were drilling deeper. It was traumatizing. So that was from trauma, but you don't want to have that happen from tooth decay if you can help it. So I know I don't either. Yes.
And so just like something like gingivitis would also lead to like gum recession.
Yes.
Meaning.
So gingivitis, we have the inflammation of the gum tissue, that redness, and then periodontitis is whenever we're going to have the effect of the gum tissue receding and then leading to increased likelihood of the teeth and the bone loss and everything like that. It's a progressive thing. And so if you have any bleeding or pain whenever you floss, if you're flossing properly and you're working up into the gum line with your floss, if you have pain or bleeding from that, keep up with that because you can remove that biome and you can recover and you can even regain your gum tissue. It can grow back down. So if you have gum loss or tissue loss, the gums can regrow. And so you can have some regain of the loss that you had as a result of gingivitis, some of it. All right.
They say you're long in the tooth.
Yes. If you're long in the tooth, that means you have had gum recession. All right.
And if your gums recede, then your nerves explode.
Yes, and you really don't want that. So this is normal tooth here on the far left. In the middle, we have gingivitis developing that will lead to the gum tissue kind of pulling away from the teeth, trying to get away from the bacteria, as well as becoming red, sensitive, and inflamed. The bacteria can then create these pockets of plaque that can become deeper and deeper down into the tissue. And eventually, because of that inflammation, the bone will be lost as well. So now you can see here, we have the bone being lost, we have the gum receding, and we have exposure of lower parts of the teeth, and just more bacteria can continue to get down and down further in there. This can be reversible if you start flossing and brushing and mouthwash regularly. An individual's risk for dental caries or periodontitis becoming a serious issue leading to tooth, bone, and gum loss is higher if you have Methanobrevibacter oralis. This is the one and only archaea that we will be introducing in our infectious diseases. All right, so this is an archaea. So archaea, are they eukaryotes or akaryotes? They are akaryotes. So the only akaryotes, the ones without nucleus or without any membrane-bound organelles, those are akaryotes. That's bacteria and archaea. Everything else that has a cell will have a membrane-bound nucleus and membrane-bound organelles. Those are eukaryotes. So Methanobrevibacter oralis is an archaea, and it produces methane. And so this is one that is associated with having bad breath. So you're going to be at a higher risk for serious effects of dental caries and periodontitis. You'll be more likely to have cavities. You'll be more likely to need root canals and things like that. What makes you more likely to have this? Having this is going to predispose you to that, but also certain genetic factors can put you at risk. People who have less saliva in their mouths or have dry mouth are at much greater risk for having periodontal disease. Whatever your behavior is, if you're not brushing, we say behavior, that means brushing, flossing, mouthwash, things like that. Your position of your teeth, if you have a lot of tooth crowding, you might not be able to get in between the teeth to clean between them well. And then the presence of mineralized plaque, which we call calculus. As the plaque becomes hard, then we have to scrape away and it's more solid. That's the calculus. And so that can actually lead to the ability for the bacteria to become protected from brushing and flossing. And then that's whenever you really have to go to the dentist to have that stuff removed. Brushing and flossing won't remove it. That's why brushing and flossing are so important, because you can remove the plaque while it's still softer and won't lead to it forming calculus. I've seen some videos on like Instagram and stuff, so I don't believe everything you see, but there's some videos of some people who have genetic disorders that predispose them to having these issues. And some people have such bad calculus build up that whenever they go to the dentist and the dentist removes the calculus, they're freaking out. The patients might freak out and think they're losing parts of their teeth. It's not parts of your teeth, yo. It is plaque that's built up. And so go to the dentist, get cleaning, and then start in with your brushing, your flossing, and your mouthwash and prevent this. Yes.
How would you get that archaea?
So it's just like you would any other part of your biome, just from exposure to other people, family members, drinking after somebody, stuff like that. So it's oral introduction. It's not going to be airborne or anything like that. All right, moving on to necrotizing ulcerative gingivitis and periodontitis. When you have these bacteria involved in your mouth biome, your Treponema vincentii, Prevotella intermedia, and Fusobacterium, like Fusobacterium necrophorum, which we talked about with pharyngitis, that these are going to make you more likely to develop something called trench mouth, which is something we saw in World War I when people were stuck in the trenches and they couldn't brush their teeth. And so this leads to a necrotizing ulcerative gingivitis and periodontitis. We're talking about necrosis of the gums and complete loss of the teeth. It's a very fast progressing aspect of periodontitis. Severe pain, bleeding, pseudomembrane formation from the biofilms, and we'll have necrosis. You're welcome. I'm not showing you a picture of that. All right, moving on to gastritis and gastric ulcers. If you get ulcers in your stomach, this is almost always caused by bacteria. It is called Helicobacter pylori. It is a urease positive bacteria. So what color would it turn your urease to? Pink. Excellent. So this is a unique one. This is one I think I've talked about previously. This is where we have that breathing test for Helicobacter pylori. It's H. pylori. And what you'll do is you'll drink you'll breathe into a baggie. That sounds weird enough, but that is what it is. You take a deep breath and you breathe out into a bag, and then you put a little cap on it. All right. Then you have to drink a little drink. And about an hour later, you'll breathe into another bag and then put a little cap on it. And those two bags get shipped off. And then we'll compare the amount of radioactive carbon dioxide in each of those bags. If you have radioactive carbon dioxide in the second bag, then what you did was when you drank that drink, you drank urea that is labeled with radioactive carbon. And when your organism breaks down urea into ammonia, which we know turns our tubes pink, and carbon dioxide, that carbon dioxide that it makes from breaking down the urea, it gets exhaled with your breath. And so the bacteria is releasing carbon dioxide from breaking down urea, and it appears in the bag. And now we can test for radioactive carbon in that little bag. And if you have that, then you have Helicobacter pylori causing your GI issues. So this causes stomach ulcers. About half of the world's population has this in their stomach biome. So it's a pretty normal part, but it may or may not cause ulcers. But if you have this as part of your biome, you're going to be more likely to have ulcers. I've had several issues with GI stuff in my lifetime, and I've had this test done. I'm negative for it, but you wouldn't know unless you did the test. And so that's the issue with that. But the best treatment for this is going to be the antibiotic clarithromycin. It is a mycin, and clarithromycin as an antibiotic would more likely affect the good try. So, so not the cell membrane. Clarithromycin will affect protein synthesis in the ribosomes. Yes.
So like how doctors say like different foods can cause ulcers, is it like messing with, is it the way to arrest?
So yes,
the
certain
bacteria?
foods will cause the bacteria to kind of overgrow or create certain products that cause the inflammation. So yes. So you can control that bacteria without antibiotics just by eating appropriate foods that don't cause it to create inflammatory products. All right, moving on to diarrhea. Pretty much the rest of this talk is going to be diarrhea and worms. Okay, so moving on. Diarrhea is defined as 3 or more loose stools in a 24-hour period. It can be caused by GI issues or it can be caused by infection. And so you might just have naturally issues with how your GI system functions, or if you have things like Crohn's disease, ulcerative colitis, IBS, or celiac disease or something like that, then you have other factors that can lead to your irritable bowel stuff. But if you have infectious stuff, that's what we're going to be talking about today. So 3 or more loose stools in a 24-hour period. And we're talking about diarrhea that lasts 2 weeks or less. Okay. So 1/3 of all diarrhea cases are transmitted by contaminated food. Other stuff can be transmitted by oral fecal route, just from not washing hands and then contaminating that way. We'll move on. These are some of the statistics on this stuff. I'm not going to test you on the statistics, but these are top 5 causes of foodborne illness. If you do not, notice that norovirus is the first on here. We attribute norovirus to being the cruise ship virus that people get sick from being on cruise ships. But if you think it's only on cruise ships, you are kidding yourself. It is everywhere, all throughout the community all the time. It's just in a cruise ship, you're in a confined space with people on a day-to-day basis every single day who aren't washing their hands. And most people don't give credit to people, y'all. Y'all going into healthcare, you probably wash your hands, but most people are not doing it. All right, let's move on to some of our causes for stuff. Salmonella is a gram-negative motile, and it's gram-negative bacteria. It is motile. It has flagella, and it has these antigens H, K, and O. So a lot of our diarrhea-causing bacteria can be identified by their H, K, or O antigens. The H is the flagella, the K is the capsule, and the O is a cell wall antigen, or the outer membrane antigen, and it just depends on what we're talking about in what bacteria. But we use H, K, and O for identifying these organisms. This guy is a glucose fermenter that produces acid and gas in glucose. It produces H2S, which we know if you sat at table 6, and you know that your bacteria definitely turned your sim tube black, right? So that's the case with Salmonella species in general. It grows pretty well. It does take a higher infectious dose. So you do have to have like 50 or 60 bacteria introduced into your system to cause the disease. Compare that to like tuberculosis, which only required like 10 to get in your system. Salmonellosis is the disease that is caused by just general salmonella infection. We have enteric fever or gastroenteritis. You might have a fever a little bit, and it could potentially lead to septicemia, but most people are just going to have gastritis symptoms. So diarrhea and vomiting and mucosal irritation. When we have typhoid fever, typhoid is a type of salmonellosis with a particular serotype of Salmonella enterica. So Salmonella enterica, serotype typhi. So we might also call this Salmonella typhi. But this is a version of Salmonella that causes a much worse presentation of the disease, and it has a higher mortality rate associated with it. Have I talked to you guys about typhoid Mary before? I don't think I'm bringing up with this. She's the cook that wouldn't wash her hands and stuff like that. And so she kept getting people sick. She didn't have typhoid, but she carried the bacteria in her gallbladder. And so she didn't have presentation of the disease, but that she wasn't washing her hands when she prepared and served the food. And then she was killing people when other people did get typhoid fever from her. So that typhoid fever is the Salmonella serotype typhi. Next is Shigella. It's another gram-negative rod, but it is non-motile. It is the bacteria Shigella dysenteriae. So dysenteriae, what disease do you think it's going to cause? Dysentery. And dysentery is bloody and highly mucousy diarrhea. So if it has blood in it, we'll categorize it as dysentery. So frequent watery stools, you might have dysentery, nausea, and vomiting, and mucus from the GI tract will also be present in your stool. So very mucousy, very bloody stools is associated with dysentery. So this is Shigella dysenteriae. It is a foodborne illness. It has certain toxins associated with it, including the Shiga toxin and the enterotoxin. The Shiga toxin and enterotoxin are really involved in like that inflammation and the bleeding in the GI tract that leads to the dysentery presentation. So here is a normal GI tract versus somebody that has Shigella. And so we look at the intestinal lining of the person that has Shigella. You can see that it is bloody and inflamed, and we've lost some of those basically like crypts and things like that that are associated with helping with nutrient absorption and everything like that. Next is E. coli, and man, do we have some E. coli for you guys, okay? So E. coli, Escherichia coli is a gram-negative motile bacteria, and certain versions of E. coli can be normal in your gut biome. Some of them are good, healthy, helpful bacteria, but certain strains of E. coli can cause diarrhea and other effects. So this particular strain of E. coli, O157H7, is the one that all of the news media is more interested in. If you have contaminated food from E. coli, they're concerned about E. coli O157H7. And this is also known as STEC. And that's how you're going to be tested on it on the test, okay? So STEC stands for Shiga toxin producing E. coli. So this is E. coli that produces that same Shiga toxin that we saw in Shigella. And so this will be associated with dysentery. All right, question.
It can also cause food poisoning.
Yes, so that can also cause food poisoning. We'll talk about what the difference is between food poisoning and actually having an infection with the bacteria in a little bit. Those are different things, okay? So STEC, very commonly associated with foodborne illness, dysentery, diarrhea. And if you have STEC infection, this can lead to your body having this inflammatory response that can cause severe damage to your kidneys, leading to hemolytic uremic syndrome. So we have inflammation causing damage to the kidneys as well as damage to your blood cells just from the inflammatory response. And then that can lead to anemia and damage, kidney damage that can be fatal. All right, moving on to other E. coli. When I say there's more E. coli, I mean there's more E. coli. So we have ETEC. This is enterotoxigenic. This is a traveler's diarrhea. It's not going to be associated with dysentery, but it's more common E. coli that you get just leading to just normal, foodborne sickness, not as severe as the STEC version. Enteroinvasive E. coli. This is one that's going to be leading to a different kind of dysentery. It's more common in developing countries, not as much here. Enteropathogenic E. coli, we have watery diarrhea and vomiting. We have a smoothing of the gut surfaces, so we're not able to necessarily do stuff with that. Enteroaggregative E. coli, so definitely the three that I'd be aware of, STEC and the last two, enteroaggregative E. coli and diffusely adherent E. coli. So enteroaggregative E. coli, we have bacteria in the gut that leads to a chronic presentation of diarrhea. Usually we're going to see this more commonly associated in children and people with AIDS. And then diffusely adherent E. coli is the one that is responsible for your urinary tract infections. It's more adherent than regular E. coli. It has adherent factors like Fimbriae that allow it to be resistant to being flushed out by urination. Moving on to Campylobacter. Campylobacter jejuni. This is a bacterial infection. You'll have watery stools, fever. This is diarrhea. It's bacteria that causes diarrhea. It is a microaerophile, meaning that it doesn't need as much oxygen. So it helps in culturing it. You can actually culture it in a very low oxygen environment, and other contaminants will not grow as a result. So it is found in the intestine of animals and in the oral tract of animals and people as well. But once it gets into the gut and overpopulates is whenever we see this infection. It's the most common bacterial cause of diarrhea. It's not necessarily most severe, but it is one of the most common bacterial causes of diarrhea. And whenever you have like turkeys and things like that, yes, you might get salmonella. Of course, we're talking about poultry, but also one of the most common culprits for undercooking foods is going to be Campylobacter, and not necessarily other things. So. All right, it's transmitted oral fecal as well as just from contaminated food sources. It can be transmitted from contact with stool from animals as well. So puppy poo-poo and stuff like that can transmit it. In some very minor, very rare cases, but in some cases it can lead to the development of Guillain-Barré and neuromuscular paralysis. Moving on to Clostridioides difficile. It used to be called Clostridium difficile, but either way, however you want to look at it, this is Clostridium difficile is C. diff. This is C. diff. Okay. This is an endospore forming gram-positive rod. It's part of the normal biome of the intestine. If we take antibiotics and kill off your normal biome, then you'll have overpopulation of C. diff. That's called superinfection. It leads to something called pseudomembranous colitis and is associated with taking antibiotics. Most of the time, if you're taking a broad spectrum antibiotic, like to prepare for surgery or to treat a infection that's being resistant to less strong antibiotics, then we'll take this and it will kill off your gut biome and the superinfection begins. It has certain enterotoxins that lead to necrosis of the wall of the intestine. And it can often hide out in the crypts in your intestine, and people who have diverticulitis or they have much deeper crypts in their intestine can actually trap this bacteria, and no matter how much you treat with antibiotics, it'll be almost impossible to get rid of this bacteria completely from their gut. And so it becomes a very chronic infection. So usually we will withdraw antibiotics and replace fluids and see if that person can regain their biome. If not, then we will treat with fidaxomicin or vancomycin, which are much stronger antibiotics, and treat with that. Another common treatment for C. diff will be metronidazole for anaerobic bacteria, right? It's also used for protozoa, for the amoebas, yes, as well as ciprofloxacin. And so using that combination of drugs usually is going to be involved in order to control the population. It's going to be next to impossible to eliminate it completely, but the hope is that we can get rid of the C. diff, so it's only in small numbers, and then we can repopulate with a healthier biome. And we can do that by introducing the fecal transplant, usually from somebody you live close to, so you're likely to be able to recover. So when we look at C. diff in the intestine, here on the left is a healthy, normal colonoscopy of somebody. On the right, we have an actual membrane that has been formed from the bacteria. It's a biofilm that forms a membrane across the entire intestine and can actually make passing stool harder. It literally blocks it off. All right, moving on to Vibrio cholerae. You've probably heard of cholera and probably have no idea what disease that is associated with it. So cholera is the disease. The bacteria that causes it is called Vibrio cholerae. It is a curved rod. It is motile. It has a flagellum, and it causes cholera, which is watery rice water stools. And so initially you'll start off with diarrhea, but it will very quickly turn into rice water stools. And when I say rice water stools, I literally mean like if you boiled rice and took the water off of that rice, that's what these people's stool looks like. It's not poop anymore.
It's like white clear.
Yes, it's white clear. And so this is vomiting. You have profuse water loss through the anus. Okay, you're pooping water. And what happens is this leads to a loss of blood volume because that water is coming from your blood and your tissues. And this bacteria creates toxins that forces your body to do that. And so you will lose all of your electrolytes and all of the water in your body, and you die from dehydration from this, and very quickly, actually. So you get loss of potassium. You'll have muscle cramps as a result of loss of your electrolytes that help with functioning in your muscles. You'll have severe thirst, flaccid skin because you're not hydrated anymore, sunken eyes. Again, your tissues in your whole body are not hydrated anymore because you're losing that much water from this. And it can lead to convulsions and coma, especially in younger children. Plenty of adults can die from this. This is a 55 to 70% mortality rate. We can treat with antibiotics, but usually the toxin production is so strong, it's not going to help much if we treat you with antibiotics. And you're pooping out literally everything that we put in your body. So it doesn't have time to absorb through the colon, which is normally how your antibiotics are going to get absorbed. We can put you on IV antibiotics, but we need it to get to the gut to treat where the source of the infection is. And the problem is we're losing all of our fluids from our bloodstream, including probably losing your antibiotics in your bloodstream. So treating with antibiotics is not effective for cholera. Usually the best treatment for cholera is just waiting it out and keeping the person hydrated. The best treatment for treating cholera is going to be oral intake of fluids because we want to be flushing it from the inside and not just treating with fluids from the bloodstream. So we can give IVs and oral fluids both. We have beds that we call cholera beds. We don't use them as much in the US because we don't have cholera, but in countries that do have cholera, because this is an oral fecal transmission. So in countries that do have cholera, or in countries that used to have cholera, we had these cholera beds, and it was basically just a cot with a hole where your butt is. And you would just lay in the cot with your butt over the hole, and there'd be a bucket underneath to catch all of your rice water that you're expelling. And then we just wait. 50 to 70% mortality rate. This is Ebola level killing. So this is cholera. The cholera toxin is the toxin that is imparting upon all of the loss of the fluids and the electrolytes. And so this is a pretty serious effect of the infection. Again, treatment will be with rehydration therapy. Moving on to Cryptosporidium. Cryptosporidium is a protozoa. All right, so we learned a long time ago in chapter 5 that some protozoa can form cysts. And cysts are the like endospores. They're the protozoa version of an endospore. But protozoa are eukaryotes. And so protozoa that are active and dividing and making toxins and things like that, we call those trophozoites. And the cysts are the hardy resistant versions. Well, as it turns out, Cryptosporidium is a protozoa that makes pretty hardy cysts. And these cysts are resistant to chlorine. So you get a little poopy kid in your pool. A little poopy kid gets in your pool, or the public pool, or the lazy river at the water park, or whatever. And that poopy poop gets in that water, and these cysts are resistant to chlorine. And it don't matter how if your pool is properly chlorinated or not, these cysts will resist it. And then you go swim in that water, and you get some of that water in your mouth, and now you get cryptosporidiosis, which is diarrhea caused by this protozoa. It's pretty resistant, and if you've ever been a lifeguard, then you know people are pooping in pools all the time. This is not like a once every month type of a thing. We're talking every day. So outbreaks are commonly associated with public pools. This is an image of Cryptosporidium attaching to the intestinal wall. Now, the cysts don't cause disease. The cysts get into your body, then become the trophozoites. The trophozoites multiply and create the toxins that are associated with the disease, right? The cysts are dormant. Next is rotavirus. One of the easily the most common cause of bacteria or of diarrhea overall is rotavirus. Oral transmission of this guy. It's a viral version. It's going to be a more subdued version than what we see with some of our other pathogens. But it's easily the most common cause of diarrhea overall. There are vaccines available for rotavirus if people are at particular risk, but most of the time we don't vaccinate for it. Then we have norovirus. Norovirus is more associated with foodborne illness, whereas rotavirus is just like commonly spread throughout the population. But norovirus associated with foodborne and usually fecal oral transmission as well. And this is our cruise ship associated diarrhea virus. Okay. Moving on, acute diarrhea with food poisoning. Food poisoning means that the bacteria are creating toxins. The bacteria don't have to infect you. They don't have to live in your body and cause an infection, but they can create toxins that can make you sick. And so we call this intoxication or food poisoning. You've been poisoned by the toxin created by the bacteria. The most common cause of foodborne toxin poisoning is going to be Staphylococcus aureus. So Staphylococcus aureus makes an enterotoxin that leads to nausea, and vomiting, diarrhea, nausea, and vomiting associated with the infection, not the infection, the toxin. This toxin that it produces, it can grow on your food, the bacteria can, and it produces a pretty decent amount of toxin, and it only takes a little of that toxin to get into your body to cause the disease. Now, because you're not actually infected with the bacteria, it's a self-limiting disease. Once that toxin isn't working anymore, you're done. So if you ever get a 24-hour food illness where you're pooping and vomiting, it's almost always staph caused it. Now, you didn't have an infection with staph, you were affected by the toxin that it produced. And it's usually from your food. Somebody touched it and had staph on their hands, and it grew in your potato salad. So if you have food that's been sitting out at room temperature for more than an hour or two, it is at high risk for having this foodborne illness. Extremely difficult to control, and food testing places don't usually test for it. This is food poisoning. So 24-hour gut illness is usually food poisoning. But if you are sick for longer than a week, that's these infections. So now we're starting to say, oh, everybody gets diarrhea, everybody gets food poisoning. Yeah, but they don't usually get the infections. So salmonellosis, when you get salmonella, you ain't sick for a day. You're sick for a week or two. Diarrhea for a week or two, not for a day. So you probably haven't had those. You probably have had this. Almost everybody has. Usually get sick within 1 to 6 hours. So if you eat something and you start getting sick within 1 to 6 hours of eating it, and you're only sick for a day, this is your culprit. But this isn't the only thing that can cause this. Bacillus cereus is commonly associated with this as well. So this guy can create endospores that can live under heat lamps, and the toxins that the vegetative bacteria produce can cause food poisoning. And then Clostridium perfringens, which was associated with gas gangrene, also can do the same thing. It creates toxins, and then the toxins can cause you to have GI symptoms. All right, moving on to chronic diarrhea. Chronic diarrhea is something that lasts longer than 14 days. If you had loose watery stools at least 3 times a day in a 24 period, and that has gone on for more than 14 days, for more than 2 weeks, you now have chronic diarrhea. So chronic diarrhea can be associated with things like IBS or ulcerative colitis. But when it's caused by the infectious causes of things, that's what we're going to be talking about today. So we already talked about EAEC, which was the enteroaggregative version of E. coli. This is associated with chronic diarrhea, usually in children and people with immune system issues. It's transmitted through food and water. Next, we have cyclospora. This is caused by a protozoa, cyclospora. Oh my gosh, Cayetanensis. Okay. So cyclospora creates these cysts that can be resistant, and we can actually diagnose it. We call a wood light. It's a UV light that can actually cause the cysts to glow. And so we can take a fecal sample and spread it on a slide and then shine this light on it, and the cysts will glow in UV light. Again, watery diarrhea. Okay, moving on. Giardia, also known as a traveler's diarrhea as well, but this will lead to a chronic version of traveler's diarrhea, and it can last for months. We have diarrhea of a long duration, months, like I said, abdominal pain, flatulence, and greasy malodorous stools. Giardia is commonly found in water, especially in freshwater sources. And even if you have a stream that's nice and bubbling and clear water, it still might have Giardia in it. These guys are pretty easily killed with boiling, so boil your water for 30 minutes before you drink it if you go camping. Yeah. So these guys, and they can become part of your GI system. So this is what Giardia looks like. It's commonly carried by normal animals in the wild, and it can survive up to 2 months just naturally in the environment outside of the animals. And it can also be found in treated water, municipal water, if it's not being properly treated. It's one of the things that we look for. So entamoeba, this is Entamoeba histolytica, which we kind of remember vaguely. It was the blob with some blobs in our slides. But this guy also has a non-motile cyst version, which is a little bit more resistant to the environment, and then the trophozoite version that causes the disease. Do you have a question?
For Giardia, I know people will use like life straws. Would that not help with that?
Yes. Yes. So life straws will filter out the Giardia from that. So you can drink your water with that, or you can boil it. But yeah. Amoebiasis. This is amoeba. Amoebiasis is what it causes, and this is associated with dysentery. This guy is. So intestinal amoebiasis, we do have dysentery associated with this. So that's kind of the defining feature between histolytica, Entamoeba histolytica versus giardiasis. Giardiasis has the greasy malodorous stools for months, but this guy can lead to dysentery. Okay. All right, hepatitis. Hepatitis is anytime you have inflammation of the liver. This can be caused by infectious causes or not. We can actually cause necrosis of the liver tissue. And then when the liver tries to heal from that, we have scarring that we refer to as cirrhosis. We have hepatitis A, which is all the hepatitis that we're going to talk about today are the hepatitis caused by viruses. We have Hep A virus, which is commonly oral fecal transmission. And it usually is going to have subclinical signs and symptoms associated with it, not as much disease presentation, but some people might actually get true hepatitis and jaundice associated with it. There is a vaccine available for Hep A. For Hep B, another virus. It's a DNA virus. And just like, it's not a herpes virus, but just like herpes virus, it can insert its DNA into your DNA. And in fact, weirdly enough, Hep B, while being a DNA virus, also has reverse transcriptase. So what it does is it makes an RNA copy of its DNA for just translation, DNA to RNA to translate that. And then it will use that RNA to make the DNA that it inserts into your DNA. And so this can be associated with carcinoma. And so this can lead to cancer development when that happens. There is no effective treatment for Hep B. So this is more commonly spread through blood transmission and things like that, sexual transmission as well. But Hep B, there is a vaccine, but no treatment for Hep B. Okay. Hep C. Hep C can also lead to severe cirrhosis as well as cancer development, but there is a treatment for Hep C. So Hep C is more like intravenous drug or blood introduction. So sharing of needles and transfusions and things like that can lead to the spread of Hep C. Most people will have a Hep C infection forever, but there are treatments, antiviral treatments that are available that can actually cure you from hepatitis. So that's available now. There's treatment for Hep C, but no vaccine for Hep C. There's vaccines for A and B, no treatment for B, treatment for C, but no vaccine. Okay. All right, helminths, let's do it. These are our eukaryotic worms. We're going to run through them real quick. They usually have the definitive host being the one where the actual sexual reproduction will be occurring in. We diagnose this by eosinophilia in your blood work. So if you have a high number of eosinophils, the eosinophils are basically there to help deal with parasitic infections like the Helminth infections. So we'll look for that in your blood work, but in your stool or in any biopsies of tissue that we might think are affected, we will look for eggs, larvae, or adult worms. There's no vaccines available for any of these. Most of them are transmitted through water or fecal oral route, but not all of them are. We want to be sure that we're washing our vegetables. A lot of these diseases can be transmitted by snails and things like that are on your produce. So be aware of that. So first we have Enterobius vermicularis. This is the pinworm. This is the one that kids in America, it's often pretty common in kids before they get the itchy butthole. You put the tape on the kid's butt overnight, and then when you take the tape off in the morning, if there's worms stuck to it, they have pinworms. Enterobius vermicularis. And so this is easily treated with like ivermectin and things like you can get over the counter to treat this. Usually if one family member has pinworms, you should treat the whole family. Sort of like lice that way. All right, next is the whipworm. This is Trichuris trichuria. Humans are the only host for this. This is only human to human transmission, whereas pinworms can actually be maintained in animal populations, and we often get exposure to pinworms in like sandboxes and things like that, where cats are pooping, other animals are pooping and stuff like that. But this Trichuris trichuria, the whipworm, is only in people, and we have female worms laying 3,000 to 5,000 eggs daily. So this is easily transmittable through feces from person to person. Again, oral fecal transmission here, it can lead to dysentery and hemorrhage of the bowel over time, as well as rectal prolapse, where your rectum can actually start sticking out from your anus. Next, we have Diphyllobothrium latum. This is the tapeworm that is associated with fish. This is the sushi tapeworm. That's all we really need to know. We do get this here in America. And then we have Hymenolepsis tapeworms. Hymenolepsis tapeworms are what we call the rat tapeworms. They're usually associated with other animals having tapeworms, and you can get this in people, but it's much more common in animals. Next, we have Taenia solium, another tapeworm, but this is the more common tapeworm that we think of, the big long one that comes in segments, and the segments break off. Those segments contain eggs. Those segments are called proglottids. And so this can actually lead, if you ingest a proglottid, if you ingest the tapeworm eggs, like directly instead of ingesting contaminated meat. So the normal way to get this is by ingesting contaminated meat. But I'm sure you guys have heard, right? They used to sell tapeworm segments that you could take as like a pill for weight loss because the tapeworms absorb the nutrients in your gut. And so that could potentially lead to weight loss. People were doing that for weight loss. And what happens is that usually doesn't lead to developing a tapeworm in your gut. Those worms, when you ingest the proglottid like that, usually are going to lead to the tapeworms taking up house in your tissues. And this can lead to cysticercosis. So this is when the tapeworms take up house in your soft tissues. And more commonly, that will present as neurocysticercosis, where the tapeworms will take up house and create encysted capsules where the larvae are in your brain tissue. There's almost nothing we can do for you if that's the case. You can perform surgery on somebody that has neurocysticercosis, but if you rupture the cyst, it's almost instantaneous deadly inflammation in the brain. So you can't risk rupturing the cyst. And there aren't medications that can cross the blood-brain barrier for this. So having neurocysticercosis is a deadly infection. Or next, we have Ascaris lumbricoides. Ascaris lumbricoides is the giant intestinal roundworm. This is a person holding out a very common-sized version of these worms. They look like that. They look like big old worms. That's why they're called the giant intestinal roundworm. This is by far the most common of all of the Helminth infections in the world. We don't have this in the United States, so that should put it into perspective, our lack of appreciation for what's going on in developing countries. Because this is by far the most common Helminth infection in the world. We have pinworms here.
You say like how common, how common in other.
I don't know the exact numbers, right? But definitely in what we call them third world countries, these places that don't have proper hygiene or water treatment and things like that, that you can expect most people to have had this at some point. So it's pretty common in those areas. It's transmitted by oral fecal transmission or contaminated water that's been contaminated by the eggs that are present in the feces and things like this, because they don't have proper water treatment. Worms are basically the worms as they grow up, the larvae can migrate up your GI tract, and then they'll move into your throat, and you'll cough on them and things like that. They can also move in through your what am I trying to say? into your bloodstream, the larvae can migrate from the gut into the bloodstream, migrate into the respiratory tree, and develop in your lungs. And then they will migrate out of your lungs through your throat, and then you will cough because you have worms in your throat, and then swallow the worms, and it just causes reinfection that way. So these guys like pretty much migrate through a lot of your tissues in your body. And then you can actually see pictures of people who have this disease where the worms can actually be coming out of their mouths and noses as a result of migrating through the respiratory tree. That's more commonly seen in kids. But yes, this is a horrible disease to have. Then we have Opsithorchus sinensis and Clonorchus sinensis. Yes, we did see these in the eukaryote lab, if you remember vaguely. But these guys are Chinese liver flukes. They can actually grow in the bile duct, and they can block the bile duct and cause severe symptoms similar to what we see with gallstones. Then we have trichinosis. This is transmitted by our Trichinella species. Again, these are parasitic worms, and they insist in the muscle tissue. And this is why you have to cook your pork thoroughly, because pork can have this naturally, and it will be in the muscle tissue. And then beef can have it too, but it's much more common in pork because pigs are gross. So we've already talked about that. But this is fecal oral transmission, and then these can migrate out of the gut and into the muscle tissue and create cysts in the muscle tissue. This is why you have to cook your pork thoroughly. This is why. And we believe that that line of thinking of you have to cook your pork thoroughly or else you get these worm diseases and die is what we believe led to the development of these religious practices that don't involve eating pork. That their people weren't allowed to eat pork, and they're thinking, oh, if we don't eat pork and obey God's laws, we don't get sick. Not realizing that by not eating pork, they're not getting exposed to trichinosis. And then that's what's actually leading the lack of the disease. Not saying that there's not value in religion. I'm just saying that's probably where that came from. All right. Trichinosis, again, abdominal issues, diarrhea and fever. And then eventually this will spread into the muscle tissue where you'll have muscle and joint pain, stiffness of the muscles, puffiness around the eyes from the inflammatory process throughout the body, and eosinophilia. Next is schistosomiasis. This is going to include Schistosoma masoni and Schistosoma japonicum. Both of these guys have a very similar presentation of disease, though they are not genetically very similar to one another. Similar life cycles. They all have a life cycle in snails in the fresh water. And so what happens is people can get infected, or animals will get infected with this, and then they spread out the schistosomes through like feces and urine into the fresh water. The snails become infected. That's part of the life cycle. And then the larvae, the worms that are ready to procreate and stuff like that, get in through your skin in fresh water. And so what happens, these actually migrate into your skin through intact skin. And so if you're swimming in fresh water in the wild and you get a rash afterwards, you may or may not have schistosome infection. And so this is what we call the blood fluke. These are flukes. And so they are flatworms, but they are not tapeworms, right? These are flukes. And so those are called trematodes. And so these guys get in through intact skin and migrate into the bloodstream, and they also involve infection of the liver and things like that. The itchiness and the rash that develops where these guys get into the skin, we call that swimmer's rash. And then it will eventually lead to the worms invading all the tissues of the body, can lead to overall unwellness, cough, diarrhea, and things like that. And a chronic infection will lead to hepatomegaly and splenomegaly from the inflammation in the liver and the spleen, respectively. These guys can also live in the bladder and cause obstruction of the bladder as they're multiplying inside the bladder as well. They are able to shift the antigens on the surface of the worms, and that this antigen shifting makes it hard for our body to be able to have an immune response against them, a memory response. We do use praziquantel to treat this. So that's it for our GI stuff and our Helminths. I'm going to leave the questions once again, for you guys to review on your own time. Let me know if you have any questions about the questions. Otherwise, we're going to head up to the lab. So I would recommend we're going to go up to the lab. And while we're waiting for me to set everything up, so I have to add some reagents and crap like that, you know that's coming. So turn on my microscopes and all that. While I'm doing that, I would get ready with your laptops and make sure you're pulling up the Respondus lockdown browser thing for the test. And then I will let you guys in and be sure that we are ready to log in when we get into the lab. Wear your lab coats. Be sure you have closed-toed shoes on, or you will lose 5 points on your test.
I got that.